My name is Dr. Jo White. I'm a clinical psychologist and advanced certified schematherapist, and I'm very lucky to be here today with two expert ISST trainers to talk about guilt, shame, and dissociation. So the group very generously have given us some questions to discuss together. So Helen, would you like to introduce yourself?
Yeah, sure. Hi, Joan. Thanks ever so much for inviting us. So I am Dr. Helen Startup. I'm a consultant clinical psychologist. I'm a ISST advanced level schematherapist, and I'm also sort of a practice CBT as well. I'm based in the UK and have worked in kind of various specialist services, really, mainly in the NHS, specialist services for psychosis, for complex trauma, and also for eating disorders. And I'm just really interested really in how to sort of maximize schematherapy really to benefit individuals in particular who've, endured a lot in life. Yeah, that's me.
Thank you, Helen. Janis?
Hi, thanks, Jo. Yeah, real pleasure to be here. And so I'm Janis Briedis. I am a counseling psychologist, also based in UK. And Helen and I, we run together a schematherapy school. So we do lots of trainings in schematherapy and schematherapy related topics. And I'm also ISST trainer supervisor. And I have worked for many years in NHS, running various services, including setting up schematherapy related services, and working a lot with complex needs, complex trauma, complex PTSD, and so on. So at the moment, I'm in private practice and also co-directing schematherapy school. And I have a lot of interest in integrating various different models with schematherapy, working with complexity, and I have a special interest in integrating body techniques in schematherapy work. So that's me.
Thanks, Janis. Okay, so let's have a look at the questions. We've got 5 questions to go through today. So the first question is from Charlene. So Charlene has a client who struggles to accept that she, like other humans, have parts that she likes and parts that she doesn't like, with her wanting to disown the parts that she doesn't like and wanting others to not acknowledge them too, thinking I'm too loud, too dominant, too fat, etc. So she's tried lots of chair work, imagery and cognitive techniques, but is feeling a little bit stuck on that one. So Janis, I think you were going to answer this first question for us.
Yes, yeah. Well, I guess maybe there are lots of ways to answer this. I guess one would be to, first of all, acknowledge that, we all have our ways of coping. And particularly if we have had difficult childhood experiences, we will develop what we call in schematherapy coping modes. And, if we think sort of along the lines of quite complex trauma, often it can lead to something we call dissociative parts. And I would say that probably, kind of dichotomy of good versus bad parts and also trying to disown certain parts can be a way of coping with something that may otherwise feel really overwhelming. And I think the first step, particularly using this approach that we are looking at in the workshop we'll tell you about a little bit later, is to acknowledge that each mode and each part has its function. And we really want to sort of get away from the sort of thinking that some parts or modes are good or bad, because actually every mode and part has its purpose, has its function, has its intention. And what we try to do as therapists is to, together with the client, to figure out what that function is. And underneath that, we recognize that each part has positive function in a way of protecting the client in some way. So whatever Charlene's early experiences may have been, it's important to recognize that this part or mode has good intentions for the client as a way of protecting from something that would feel overwhelming or dangerous or whatever the reasons might be. So where we would start with that is we might, let's say one way to do that would be we could put that part in a chair and and have a gentle dialogue conversation with it and inquire about, where has it come from? What is its intention? What is it trying to protect? What would happen if it wasn't there doing the job that it is? And really, ultimate goal is to befriend, in a sense, all parts and understand that they all fit into some kind of a bigger scheme, bigger self in a way. And what we know about parts that have quite sort of strong feel about them, or strong opinions maybe, is that they often stem from very difficult early experiences where feeling something would be just way too much, would be way too overwhelming. So what we want to address is both the coping strategy, but also the underlying distress, and understand where that's coming from. And so in schema therapy, we use terms such as limited parenting, where we would acknowledge and try to meet the need of the vulnerable side, vulnerable child, as we call it in schema therapy. And so by doing that, we are aligning ourselves with all parts, in a sense, trying to befriend them and trying to get them to work together more collaboratively. So we don't need to split between good or bad, and understanding that they all fit into quite a, sophisticated, elaborate system. And ultimately trying to put what we call healthy adult in charge, whether that is with schema modes or dissociative parts, whatever language we tend to use.
Right, thank you. That's a really comprehensive answer, Janis. And I've certainly found since I did your workshop, gosh, when did you run the last one? In September, maybe it was? That kind of shift in approach from really being non-judgmental towards all parts, and how important it is, particularly for some clients, and how it can really open up understanding in a way that I wasn't able to quite access before.
Yeah. I think the important part of that, just to say maybe one more thing, is that these parts that often want to avoid or deny, they often hold really deep fear. And I think it's recognizing that and understanding that helps us develop empathy towards that part, which then makes us feel less it makes it feel less alien somehow. Yeah.
Thank you. Okay, so second question then. So this one's from me, Helen. So do you have any ideas to move forwards with someone who feels such hatred of their little child and their emotions that as soon as they feel anything, they immediately feel ashamed and needy?
Yeah, and this is kind of sadly reasonably common, and often a sign that the kind of vulnerable child part really is in many ways fused with the critic. So there's no sort of wiggle room or space between them, essentially. So as you say, any sort of mention of need or emotion sort of triggers this annihilation really from a very attacking critic, which kind of generates huge amounts of shame, or really sort of shuts the whole system down really, and can become quite paralyzing. What we tend to do there is, in a sense, because of this fusion, this sort of more traditional way of working with the critic in schema therapy, to sort of face the critic head on, if you like, can be a bit much, because it's essentially like you're confronting an aspect of the self, or asking someone, if it's an introduction of an abuser, for example, to essentially stand up to an abuser, which can, very quickly, as you can imagine, shift people out of their window of tolerance, and can just simply feel like they are attacking something that's integral to who they are. So in this situation, what we would do is we tend to treat this type of critic more like a coping mode. So we become, we would perhaps put it on a chair, sort of get to know it, get alongside it really, before we can have any hope of developing a slightly separate relationship towards it. So we'd be curious about things like its origins and its functions early on. So, for example, where there's a scenario where someone has been constantly attacked by maybe a parental figure who's abusive, it can be adaptive in one sense to turn towards a critic, because at some level it kind of keeps you safe. So we would be curious about what the functions of attending to or being attached to in some way a critic are. You know, some of the ways in which that kind of manifests more currently. And then we are involved in more of a kind of negotiation process really with the critic, which is around, you know, recognizing that essentially the critic has been taking a huge amount of responsibility for the self in a way, and thinking about ways that we can potentially hand over some of that responsibility to a healthy adult. So it's a kind of handing over, it's a kind of negotiation stance. I think of it as just trying to create really a little bit of space or wiggle room so that, you know, that there is some potential relationship with the more vulnerable side that doesn't automatically trigger this kind of attack. And, you know, we're also sort of thinking about, you know, how can we slowly build people's tolerance up really for vulnerability? You know, it can be sometimes the cognitive or behavioral ways of working can be a way in. You know, sometimes it's sort of, you know, get people to have to notice in the environment children of a certain age that they would have been at one time when difficult things were happening, to think about what their capabilities are. You know, what is the realistic theory of mind of a child of that age? What are its capacities and capabilities, to try to do a little bit of cognitive work or anything that could get a sort of chink in that fusion. I think the other sort of thing to hold in mind, I guess, is that, you know, our reparenting stance in and of itself can be really triggering for people and can shoot people out of their window of tolerance. So again, you know, we need to calibrate that, think of it on a continuum. So we're gradually exposing people to warmth in a way that feels manageable, and remembering that, you know, where people have had relational trauma, you know, our very encounter with them has the potential to be traumatizing, to be as closely attuned and sensitive as we can be in forming that relationship and in working with any of the parts.
I love that. The kind of real sophistication of using schema therapy tools with somebody with, you know, often these individuals where the critic and the vulnerable child are so fused, you know, such complex trauma and very attachment based, isn't it? So
absolutely attachment based. Yeah.
Yeah, thank you, Helen.
Thanks, Joan.
Okay, so next question. So this one's from Rasmin. I work in forensic setting, and my patients are often faced with guilt and shame about their offence, and I'm looking for ways to reduce their shame, yet helping them to accept responsibility for their actions. I think, Janis, you're going to speak about this one.
Yes, thank you, Jo. One of the things that I would first want to differentiate is between healthy and adaptive shame and guilt versus more toxic or maladaptive shame or guilt. And I think it's important to remember that, you know, a degree of shame and guilt is actually completely appropriate here with someone who has committed offense. And we want to distinguish between those two aspects. And I guess how we differentiate that is that I guess the more toxic aspect would be shame about the whole self rather than about the particular actions that this person has committed. And I guess the next step is to think about what, you know, for example, clients who may be stuck in a loop of shame and guilt, we will want to investigate what is the function of that. Because, you know, sometimes shame and guilt can be very productive in a way of moving forward, a way of making amends, as a way of maybe forgiveness towards oneself. It can be a push towards, you know, more awareness and understanding, and all of that can be helpful. And what we don't want is a kind of sometimes what can be shame and guilt as almost as a form of avoidance or as a form of self-flagellation, which is basically not productive at all, and just keeps the person stuck in a loop which keeps going round and round. So the way to work with that, we would want to understand what modes are these emotions related to, we often in schema therapy talk about punitive critic, we talk about guilt-inducing critic, see these are the kind of the classic modes, but there can be variations on that, and they can have multiple functions. So, there can be a strong punitive aspect, just punishing for the sake of it, in a sense, what it may feel like. But actually, the functions often are more complex than that. And we would want to investigate and understand, because what actually may be the case is that, almost like indulging in a lot of self-flagellation can be a way of avoiding taking responsibility. So we would want to investigate those sort of aspects where there can almost be something like a secondary gain from these modes kind of operating. Yeah. And I would want to explore more about what sort of amends, what repair is needed for the person to generally be able to move on. And also to remember, I think, the importance of bringing empathy into this. So it may be something that happens later in the work with this person. But, what we know, obviously, that vast, numbers of people who actually commit offense often are victims themselves in the past of things that have happened to them, have been done to them. And I think this important part of the process is to bring awareness of their own vulnerability, of their own traumas from the past, and what may have led to their committing the offense. So that could be a very important part of the sort of inner repair that needs to be done. And from that, I think putting basically healthy adult in charge of a kind of captain of the ship that can steer the ship forward into a direction of healthy responsibility, and only more towards healthy shame and guilt that is necessary to heal the trauma and to move on from the past in a way. Yeah.
Great, thank you, Janis. Okay, so next question. So Lucy is interested in learning more about the connection between emotional reactivity, so particularly anger and lashing out, and shame. She's saying that she's seen a learned coping mechanism of dissociating from the emotional experience and avoidance of emotional content, for example, TV shows, for fear of losing control.
Yeah, it's a really interesting question. It was making me think of the sort of importance of distinguishing between, particularly where there's something quite hot like anger, of distinguishing between sort of secondary shame, which can be associated more with a response held in a coping mode. So, for example, anger emanating from a coping mode. And primary shame, which may be being more experienced by the vulnerable child, and us not getting too pulled into necessarily working at the secondary shame level, sort of at the expense of thinking about what's going on underneath the self, which could be a whole, range of sort of schema and experiences, sort of lonely, abandonment, defective, whatever it is. And that, what one avenue is to make that distinction. And then ultimately, I think what we're trying to do is what we are typically trying to do in schema therapy is not to get stuck at the secondary level, but to try to reach the vulnerability underneath, whether that's using kind of sort of chair work to produce some decentering or some imagery. And, whenever there's sort of shame, I always think in terms of the fact that there will be a part of the self that's doing the shaming. So there's very likely to be a kind of shaming critic, not very far away. And again, potentially coming back to this idea, linking to the point about dissociation, that actually that there is a dissociation with a vulnerable child because the critic doesn't provide it with any airspace. It essentially shuts it down, and then what we see is the more overt coping mode type anger response, for example. So, in summary, I guess we're thinking about conceptualizing and helping people see that there's different layers to these emotional experiences and reactions, that even underneath these behaviors there is a side of the self that's potentially experiencing unmet need and sort of loss. and there is a critic that's getting involved and is potentially having an effect on the whole system. And then where we intervene is kind of organised by that sort of little trio, really, of relating.
Great, thank you, Helen. Okay, I think we on to the final question. Yeah, so this one is from Claudia. So what is the best way to start with somebody that has strong internalized I'm not good enough, creating too much shame that then blocks any cognitive reframing work? The critical self is so active in sessions that the client literally cannot understand what I'm saying, contributing to the thought that she thinks I'm an idiot, for example.
Yeah, so I'll take that question. Thanks, Claudia. I mean, it's it's such a common theme, isn't it? Where often when we start work with very shame-prone clients who maybe, very intellectually, very sort of on the ball, we often see how the critic mode often hijacks their rationality and often uses rationality as a weapon almost against them. And I think it can become quite a problem, particularly with cognitive ways of working with these clients. So I guess my approach, probably, and something we'll talk about in the workshop, is we can think about the general sense of emotional safety, about what helps clients feel emotionally safe. And often the work, sort of looking from that perspective, starts very simply from how do we create safety in the therapeutic room, in the therapeutic space? How do we create safety in a therapeutic relationship and form an alliance where the client is, able to slowly work with us in collaboration and allow together to develop a sense of safety that many shame-prone clients may really struggle with in their daily life. So, it may be helpful to use maybe some strategies along the lines of soothing strategies, soothing imagery, for example, safe place, one way. But I think a lot of it boils down to the way we interact with the clients. And I think it has a lot of implications for how we as a therapist, as a person, engage some of these clients in work that feels extremely difficult, extremely challenging, because the whole essence of therapy in itself can be incredibly anxiety and shame-provoking, because we ask someone to just come in the room and talk about themselves, and many shame-prone clients find that just about the most difficult thing to do. So what we want to start slowly. We want to go gently. And I think the important thing is not to push clients too much to do something they're not ready to do. And I think building alliance and collaboration and giving clients a degree of control over what happens here is really, really important. It cannot be emphasized more. And I think that is something that over time will help and develop a mutual sense of trust. It will help expand window of tolerance, which will then expand the client's capacity to do more in the therapy room. So often with clients who are very shame-prone or very dissociative, I would go very slowly with techniques, because techniques in themselves, we have lots of wonderful techniques in schema therapy and other approaches, but I wouldn't want to be too techniquey in a sense at the beginning, because often techniques in themselves can be a trigger for these clients. Maybe another quite helpful framework can be drawing a little bit on compassion-focused therapy, sort of ideas of emotional regulation zones, those of you who may be familiar with that, and maybe a little kind of theory around how shame produces feelings of anxiety, how it's related to the red zone, and the whole threat system can be incredibly helpful. And then sort of setting a gentle goal around growing together the green zone, the zone of soothing, the zone of safe connection. And so I think these can be quite helpful ways, particularly for clients who might be more intellectually prone. Having some kind of theoretical foundation can be quite important reassuring and holding as well. So, and then we can sort of build on that. We can think about, different ways of identifying modes, working with that in a way that feels safe to the client. And also, one of the things that I mentioned before, one of the things we integrate in the workshop as well is working also with body-based sort of methods, things like developing a somatic sense of safety as well, using various somatic resource strategies and so on. So there are lots of ways of doing that, but I think my kind of advice first is to go slowly, go gently, and maybe work more on the experiential aspects, particularly of therapeutic relationship, and leave cognitive strategies for a little bit later when there's a strong alliance and it doesn't feel so threatening for the clients. Okay.
Thank you. Thank you, Janis. Thank you, both of you, for sharing so much of your wisdom. There were so many nuggets in there that I will watch this again so that I can properly absorb everything that you shared. Thank you for taking the time to come and talk to me. So you're running a complex trauma, guilt, shame and dissociation workshop in May. Do you want to tell us a bit about that?
Mm-hmm. Yeah, so we're excited about the workshop, and those of you who've sort of done workshops with us before, we like to have a kind of real balance between theory, sort of opportunities to practice different techniques and ways of working, and also sort of with lots of sort of demonstrations as well of different ways of working that are quite unique to this workshop. We're going to be covering sort of the core theory really that's relevant. So we'll be thinking about things like attachment perspectives and how they inform our understanding, as well as the sort of core evolutionary theory. We'll be spending a good chunk of time thinking about how do we conceptualize where there's trauma, sort of shame, guilt in the mix. How do we understand dissociation? How do we differentiate between modes and parts, for example? How do we conceptualize where there are processes getting in the way, whether they're dissociative, whether they're examples of mode flipping, for example? How do we conceptualize safely and effectively, really, where people have endured trauma? We'll be thinking about things like the therapeutic relationship and how, where there's been attachment trauma in particular, we need to be really mindful of our stance and the relationship that's building, and how, real subtle ways of being can really trigger people's threat systems. It can be sort of non-verbal, sort of facial signature or something really unintended, but can be, quite triggering. So being very carefully attuned and mindful of the sort of our understandings really from evolutionary theory, and thinking about the reparenting stance and how, again, this can be triggering, it can be healing, it can be all sorts, but we need to be thinking of it very much as being calibrated to what the individual can tolerate and what their experience has been relationally. So thinking about the sort of nuances really of the reparenting stance within this context. We'll also be talking about the critic, and as I kind of mentioned earlier, thinking about this idea of how do we work with a fused critic, so a critic that's, ultimately fused with need and emotion, and maybe a very big part of the self. How do we sort of unstick this, and how do we sort of help the individual to hand over some of the responsibility, gradually and sensitively over time to a developing healthy adult. Say a bit more, Janis?
Yeah, so thanks, Helen. You covered, I think, most of it. I just wanted to, I guess, add that, and I think Joe probably as well, you were on a workshop before. I think schema therapy and the mode model in particular lends itself really well working with this very complex client group. But I think it obviously goes without saying that many clients with extreme sort of shame, guilt, and dissociation often have suffered unimaginable trauma. And these very traumatic experiences tend to create fragmentation and split, in oneself. And what tends to happen, particularly with quite extreme dissociation, is that we get various survival-based parts that tend to fragment and represent, each part representing a different survival need or different strategy. So, for example, again, it may be familiar to those who already know something like structural dissociation theory, where there are parts that are more kind of attachment focused and other parts which are more defense focused, and I guess where we marry up the schema model with various dissociation models is that we think about how we adapt schema therapy strategies in a way that does not aggravate parts and doesn't contribute to more fragmentation, but actually contributes to integration of the self by putting a healthy adult in charge. And I think one of the kind of top tips, in a sense, from the workshop is that really what we want to create a kind of sense of cooperation and collaboration between all parts or all modes. Where parts and modes have historically, in the client's internal system, developed as kind of opposing polarized parts. What we want to do is we want to help them come together and actually understand that they're really working towards the same goal. But because the nature of the parts is such that they are not in communication with another, it can feel like these are almost like different personalities. So we try to kind of get away from that, also from that sort of language. And what we try to sort of see the way the self is coherently built. And then there is a certain logic behind dissociative systems. And through lots of dialoguing between parts and mentalizing each other and ultimately befriending, we're able to put good, strong, healthy adult in charge. So really that's kind of what our goal is to present that in the workshop. And so we will draw on lots of different theories. Obviously schema theory maybe as the first one, but also integrate ideas from IFS, internal family systems, from sensory motor psychotherapy, from compassion focused therapy, from CBT, cognitive behavioral therapy. So it's quite a blend of different approaches, thinking about how we can adapt traditional schema therapy techniques to work with this extremely complex client group. So I want to invite people to come along, ask questions if you have any. Very happy to answer. You can email us. And it would be great to see some of you there.
Yeah. Thank you, both of you. I can absolutely recommend the workshop, having attended the last one. And in terms of working with people very fragmented, it's given me a way forward when I was feeling quite stuck with a sort of traditional schema therapy model. So yes, huge amounts of value in it. So I'd encourage people to attend as well. I'll put a link to the workshop in the comments, as well as the poster and a link to Janis and Helen's website, so that you can go ahead and book your place if you would like to. So the workshop's in May, is that right? What are the dates?
Yeah, so the workshop is, we're running it over 3 days. So we doing 2 days in May, 18th, 19th of May this year. And then we're doing a third day, a follow-up, a more experiential follow-up on the 16th of June, about a month later, to help people consolidate the learning from the first days and to practice some of the experiential techniques more.
Great. Thank you, Janis. Okay, so I'll add all the details into the comments. And if you've got any questions for Helen and Janis about the workshop, then you could ask them in the comments and I can forward them through, or there are details for your email addresses on there on the Schema Therapy School website. So thank you both very much for coming and sharing your wisdom. It's been a pleasure to have you with us.
Well, thanks very much for having us, Jo. It's been a pleasure.
Thank you, Jo. Yeah, it's great to be here.
All right. Thanks, everybody, and see you next time. Bye.
Bye.